that's okay.
Starting.
No. So again, we're talking about pain and neuropathy. And so many survivors live with physical symptoms that linger way after surgery, during treatment and recovery.
Neuropathy can feel like tingling, burning, numbness, or pins and needles. It's often in the hands or feet. It can affect balance, walking, sleep, and any daily activity.
And so pain after cancer can be complicated. It could come from surgery, radiation, chemotherapy, scar tissue, that's a biggie, nerve damage, hormonal changes, that's a biggie, or just changes in physical movement, our coordination.
The key message here is do not dismiss pain just because your treatment is over. New pain, worsening pain, or pain that interferes with your daily life deserves attention.
So yes, survivors should not feel they have to tough it out alone.
There are options that may help, depending on the symptoms. Physical therapy, occupational therapy, oncology rehab, medication, supportive footwear, stretching, massage, acupuncture, mental health support, or even a referral to a specialist.
And so we can't stress enough here how important it is to talk to your medical providers, your team, before starting something new, whether it's on supplements, intense exercise, or alternative treatments.
Absolutely. Symptom care should be safe and coordinated.
Okay. So Danielle, we also need to talk about lymphedema because this is something many cancer survivors, particularly myself as a breast cancer survivor, deal with. And especially after lymph node removals, radiation, surgery, or certainly certain cancers. And I might add that I did not have lymphedema until about a year and a half after surgery. So sometimes it doesn't happen right away, but it's important to be aware of this.
Yes, lymphedema can be confusing because not always dramatic at first, like you're saying. It may start as a feeling of heaviness, tightness, swelling, achiness, or fullness in your arms, hands, legs, chest, breast, neck, face, or trunk.
And so for breast cancer survivors, lymphedema can show up in the arms, particularly the hands, the breast, the chest area, where your lymph nodes were removed in your armpit areas, your back, or your trunk. But it's not limited to breast cancer. Survivors of many cancers are experiencing this, and that also depends on where the lymph nodes were removed, damaged, or treated.
That is such an important part. Lymphedema happens where lymph fluids does not drain on the way it should. The fluid builds up and causes swelling. Sometimes it's mild, sometimes it becomes extremely painful, limiting the movement or increasing the risk of skin infections.
And so survivors need to know this. Swelling after cancer treatment deserves attention. Being aware. You don't have to wait until something becomes severe before asking for help. But if you're noticing those signs and symptoms and changes, talk to your provider about it.
Exactly. Early care can make a difference. If you notice a swelling, tight jewelry or clothing, heaviness in a limb, the skin feels tight or thickened, you can't have your range of motion as you did before, it aches, or you keep repeatedly getting infections in the area, call your team.
And so treatment may include working with a certified lymphedema therapist, gentle exercise, compression garments, manual lymph drainage, skin care, elevation, or a pneumatic pump, depending on what your provider recommends.
I also want to say this clearly. Do not just buy a compression sleeve or garment and guess your size. Compression needs to fit correctly. The wrong fit can be uncomfortable and even make your symptoms worse. Ask your doctor, oncology rehabilitation team, or lymphedema specialist for guidance.
So skin care matters is very important too. Small cuts, burns, bug bites, or infections can become bigger problems when lymph drainage is impaired. So survivors should protect those areas, moisturize the skin, and avoid injuries when possible, and report any redness, warmth, fever, sudden swelling, or pain.
And emotionally, lymphedema can be hard. It can change how your clothes fit, and it can affect your confidence level. It can be a visible reminder of cancer treatment. So if you're struggling with that, you're not being vain, you're just being human.
I'm really glad you said that because I felt that way. So yes, symptom care includes how symptoms affect your identity, your body image, your confidence, and quality of life.
Key here is this: lymphedema is manageable, but it should not be ignored. The sooner you speak up, the more support and options you have.
That's very true, and that leads us into sleep, stress, and emotional symptoms. So symptom care is not just physical, is it? It's emotional, a lot of emotional and psychological symptoms. So yes, anxiety, depression, fear of reoccurrence, irritability, grief, and sleep disruption are all a part of that survivor conversation.
Many survivors lie awake at night because the day is finally quiet, and that's where the thoughts come in. What if it's back? What if the symptoms mean something? What if I'm not who I used to be? The fear is real, and pretending it is not there does not make it go away.
And so that's where mental health, really counseling, can be really life-changing. A provider to help you to kind of normalize what's going on with you. It's not a death sentence, right? So therapy, support groups, medications as appropriate, spiritual care, journaling, mindfulness, taking a walk, right? And honest conversations can all be helpful because you don't have to do this alone.
And there's no shame in that. If your body deserves treatment, your mind deserves care too.
Exactly. So survivorship is about you and me and us out there. Survivorship is not just about scans and lab results, is it? It's also about whether we can sleep, think clearly, feel safe in our body, and experience some peace of mind again.
One thing that is practical that I really recommend is symptom tracking, but with balance.
Absolutely. So tracking can help us notice patterns. Maybe fatigue is worse after certain activities. Maybe pain interferes with poor sleep or after poor sleep. Maybe we're dehydrated. That can affect giving us headaches. Maybe brain fog is worse after we skip a meal. Maybe swelling is worse after heat, traveling, and overuse of our bodies.
And right now, that would be a key issue across the country with this heat
Oh
wave
my
that's
God.
going everywhere.
It's horrible.
Tracking should support you, but it should not consume you. The goal is not to become afraid of every sensation. The goal is to gather enough information to have a better conversation with your care team.
So a simple symptom log can include what you felt, how you're feeling, when did it happen, when did it start, how intense was it, what's helping, and whether or not how it's affecting your daily activities.
Once you've done that, bring that information to your appointment, and then it becomes much easier for you to advocate for yourself when you can say, this has happened 4 times in the past 2 weeks, instead of trying to remember everything right in that moment.
Exactly, so it's very important when symptoms are coming and going. If you only describe how you feel on the day of the appointment, your provider may not see the whole picture. So sometimes it's good to write some little notes, remind your doctor, hey, this has been going on for a week or 2 weeks.
Exactly. A symptom log gives experiences a timeline. Like she said, a week or two, I can say it's been happening at 3 p.m. on the dot after I've had my afternoon snack. This is a symptom I've been having, and it's been happening every single day for the past 2 weeks. And the doctor is going to be much more willing to listen to you and not brush it off because you've been documenting and paying attention to your symptoms.
Exactly, so we need to, that's why we're here, right? Spilling the tea. We all need to be talking about this. And when do we need to call our providers?
Did you know that survivors can hesitate because they don't want to seem dramatic or they're worried that they're overreacting?
So your care team would rather hear from you early on than wait until there's a crisis or it's much more serious. Because they tend to scold you out then, right?
And as we said before, call your provider if you have new or worsening symptoms, sudden shortness of breath, chest pain, fainting, you got a severe headache, like a really bad headache, worst that you've ever had, confusion, if you got signs of infection occurring, if there's swelling, like with the lymphedema, even with the lymphedema, if it's bad, contact your provider. Uncontrolled pain, new neurological symptoms, or anything that makes a significant difference for your body, or even just a question, regardless of how big or how small, your doctor is going to want to hear from you and want to know and make your mind at peace. So reach out to them.
Yeah, so for lymphedema specifically, report sudden swelling, redness, warmth, fever, pain, skin changes, or signs of infection. Those signs or symptoms should not be ignored.
And when I said to reach out to your doctor, if something feels urgent, you need to go to the emergency room or urgent care instead of waiting for your routine appointment.
Exactly, so the bottom line is this. You're not supposed to be bothering your doctor by reporting the symptoms. You need to be participating in your care, in your treatment. That's very crucial. And so again, now we want to speak directly to survivors who feel like their symptoms, their signs and symptoms have been dismissed.
That is such an important part.
So if you've been told you should be fine now, by now, or at least the cancer's gone, or maybe you're just stressed out, I want you to know that your experiences, how you're feeling, how you're thinking matters.
Survivors deserve to be heard.
So sometimes we just need to ask again. Sometimes we need a second opinion. Sometimes we need to bring someone with us for an appointment. Sometimes we may just need to say, this is affecting my quality of life and I need help.
That phrase is so powerful. This is affecting my quality of life.
Because symptom care is not just about survival. It's about being able to live. So when I see my doctor and the doctor says, how you doing, Carol? I say, I want to live and I want you to help me to continue living.
Yes. Quality of life is not a luxury, it is part of your care. So let's make this practical. If you're listening and dealing with symptoms, here are a few things you can do this week.
So first, choose one symptom to track. Get yourself a little notebook, even from the dollar store with a cute little pen. Just list one sign or symptom to track. Not all of them, just one. Could be the fatigue, brain fog, pain, sleep, anxiety, neuropathy, lymphedema, whatever it is that's kind of affecting you right now, kind of slowing down the quality of your life.
Second, write down what makes it better and what makes it worse.
For sure, because we all know what makes it feel worse, right? But what can make it feel better? So third, decide whether it's time to contact your care team. If the symptom is new, worsening, frightening, or interfering with daily life, please reach out to your providers.
Fourth, give yourself permission to adjust your day around your body's need. That may mean more resting It may mean asking for help. It may mean saying no.
Yes.
It may mean doing less than you had planned.
So fifth, consider asking whether a referral could help. This may be oncology rehab, physical therapy, occupational therapy, mental health support, chiropractic care, massages, pain management, seeing a dietitian, as well as a certified lymphedema therapist.
And finally, remind yourself, listening to your body is not weakness, it's survivorship wisdom. Today's tea is this: symptom care is not an afterthought. It is part of healing, it is part of rebuilding, it is part of honoring the body that carried you through cancer.
So we don't have to ignore any of those signs or symptoms to prove that we are strong.
You do not have to push through pain to show that you're grateful.
And you don't have to suffer silently because treatment is over.
You're allowed to ask for help.
And you're allowed to need care.
And you're allowed to build a life that respects your body as it is now.
So thank you for joining us on Spilling the Tea with Dr. Clay and Dr. Cherich here. And we hope that if this episode has helped you, to share it with other survivors, caregivers, or other loved ones who need to understand that symptoms after cancer are real and care is still needed.
Until next time, keep listening to your body, keep advocating for your healing, and remember, survivorship is just not about being alive, it's about learning to live well. And if you're experiencing new worsening concerning symptoms, contact your medical provider or seek emergency care where symptoms feel urgent. Until next time, bye.
Thank you. That was good.